Welcome to the FedLife podcast with Dan Sipe from Serving Those Who Serve. In this podcast, Dan draws from years of financial experience to help federal employees overcome challenges that every Fed can relate to. Join us for this journey as we reach, teach, and serve to help you make the right financial decisions. Now, on to the show.
Hello and welcome to this episode of the FedLife podcast. Once again, I'm your host, Dan Sipe. Additionally, I'm the branch manager here at Serving Those Who Serve and Sipe and Associates. And I will begin, as I always do, by saying thank you. Thank you for taking the time to listen, and thank you for your service. You do not hear that enough. You will always hear it here. I'll bet you can't guess who's back with me today. Oh, you guessed it. It's Ed Zurndorfer. The guru is here one more time as part of our ongoing mission to reach, teach, and serve you. And regular listeners, you're used to this by now. At the outset, I need to say the opinions of our guest Ed Zurndorfer, no matter how awesome they are not the opinions of Raymond James of Serving Those Who Serve. This podcast is presented for information only and is not intended to be taken as advice. All listeners should consult their personal advisors before taking any action. If you do not have a personal advisor, hit us up at Serving Those Who Serve. That's stwserve.com. We will help you any way we can. Once again, as is our wont, we will follow Ed's FedZone articles to give us one more way to reach and teach. One more thing to share with you. You will notice if you're coming to us through YouTube, there's a place there to subscribe for the weekly serving. Please do so. That will be the best content from Ed, Jennifer Meyer, Benefits Ben, and the rest of the crew at Serving Those Who Serve delivered to your inbox every day or every week, so do not miss out. It is at this time that we tend to turn our attention towards open seasons for FEHB. And Ed has a different wrinkle on this one in the notion that there are actually two open seasons for Feds over 65. And folks, if you get around to listening to this after the close of an open season, have no fear. A lot of Ed's guidance is evergreen. So Ed, on the topic of these two for one open seasons, let's start by giving us just a quick flyover of open season number one, and that is for FEHB plans.
Yes, Dan. Right now, we are in almost the end of the current open season.
Yep.
It started back on November the 14th. Open seasons for federal employees. It's called the Open Season Benefits. It's called the Benefits Open Season. It's always held every year from the second Monday of November through the close of business on the second Monday of December.
Yep.
So this year, that started on November 14, 2022, and it's going to end at the close of business this coming Monday, December the 12th, 2012, in which federal employees and retirees can change their federal employee health benefits plan. Whatever plan they're in, for whatever reason, they want to change it, they can during the open season. The same thing is true, as I say, with retirees. Federal employees and retirees can also enroll, disenroll, or change their dental insurance plan and or vision insurance plan that is offered through what's called the Federal Employees Dental Vision Insurance Program, FEDVIP.
Yep.
And finally, employees, but only employees, not retirees, can enroll, or if they're already enrolled, they have to re-enroll in the flexible spending accounts. There are two types of flexible spending accounts, FSAs. There is a healthcare FSA, and there is a dependent care FSA. There are two separate FSAs that are offered through what's called the Fed Flex program. That is, you get information found on the website www.fsafeds.com. I emphasize only employees can do this, because if you are a retiree of the government, even though you may have been able to participate when you were an employee, you're not allowed to contribute to an FSA while you are a retiree, when you are a retiree. So that's the open season for all federal employees and federal retirees. That's what's available on the table.
Okay, great summary on that. So the second open season that you talk about in your article has to do with Medicare. So walk us through that.
Okay. I am sure everyone by this time is overwhelmed by the ads on TV, on the internet. Dan, have you looked at TV recently?
I must confess, I have seen Jimmy J.J. Walker pop up.
Okay.
I've seen Joe Namath pop up.
Okay.
I think George Foreman has popped up a
Yes.
few times. I'm waiting for William Shatner. So,
Oh, he's there. I've seen
oh,
him.
is he? Okay.
And what are they advertising? They are advertising Medicare Advantage plans. What is
Yes,
Medicare
indeed.
Advantage plans? It's known as Medicare Part C, which for those individuals who are enrolled in what is called the original Medicare, that's a Medicare Part A, hospital insurance, and Medicare Part B, the medical insurance. If they're enrolled in those two Medicares, they're eligible to enroll in a Medicare Advantage plans. Now, what are these Medicare Advantage plans, Dan? Well, when they first started back in 1997, they were called Medicare Choice Plans,
Okay.
Medicare Part C. And at that time, Medicare, the Centers for Medicare Services ran these plans, and they were basically plans, I call them enhanced HMOs. We know what an HMO is.
Mm-hmm.
You go, you find your favorite HMO, like for example, Kaiser.
Sure.
That's a common one. And you go to your HMO and you have what's called your primary physician, and your total health care, all your healthcare needs are being taken care of by the HMO. And you have a primary physician. And if you have a special need, like you have to see a lung specialist.
Mm-hmm.
There will be a lung specialist within the HMO, and you stay within the HMO.
Mm-hmm.
Now, again, this is strictly, Dan, for medical services. And they were somewhat popular. People generally they like to see their own doctors and things like that. You know, they don't want to be restricted. But then during the second Bush administration, the Bush administration came up with an idea. Let's make these plans a little more attractive to Medicare beneficiaries.
Gotcha.
We're going to expand the services offered by a Medicare HMO. We're not only going to offer healthcare services, but we're going to offer dental services and vision services. And to make things better, we are going to allow private insurance companies to administer the whole thing. CMS is not going to be doing the administration of these plans. We're going to leave it entirely to private insurance companies. So the government decided we're going to open this up. We're going to find companies that are willing to do this, and we're going to pay them to administer these plans, to run these plans.
Gotcha.
So to make a long story short, right now for 2023, there are about, I think it's 43 Medicare Advantage plans available across the nation for anybody who is enrolled in Medicare Part A and Part B. When would they have to enroll? But during the annual, what's called open season. Annual open season.
Mm-hmm.
And that is held every year, Dan, between October 15th and December 7th, in which, once again, anybody who's enrolled in Medicare Part A and Part B can join a Medicare Advantage plans. There is no lack of insurance people who will help you find a good Medicare Advantage plan.
Gotcha.
Now, are federal retirees who are enrolled in Medicare and be eligible for these what I call private Medicare Advantage plans? And the answer is yes.
Mm-hmm.
And retirees who said to me, "Hey, Ed, wait a minute now. I'm enrolled in the Federal Employee Health Benefits Program. I was eligible to keep my FEHB benefits during when I was in federal service. They told me if I want to keep my federal employee health insurance for retirement, I can, as long as I'm in there for at least all of the last 5 years of my federal service.
Yep.
And I can change my plans when I'm retired every year. Most importantly, Dan, the government pays 72 to 75% of a federal retiree's insurance premiums. I am a federal retiree.
Yeah.
I'm enrolled in a federal employee health insurance plan, and the government pays 72 to 75% of my premiums, just like they did when I'm an employee. I think we've talked about this in the past.
We have.
This is a tremendous benefit when you are a federal retiree.
Absolutely.
I don't know too many people in private industry who get that benefit.
No, good. Speaking on behalf of Team Private Industry, I can say that's absolutely true. So a little bit of recap here. So, you indicate in your article that the Advantage plans got started around 2004, and then between 2007, 2017, they became a lot more popular. And you said along about 2017, that's where FEHB started to bring in Medicare Advantage options.
And the
Talk
reason
through that.
And the reason, yes, and the reason they got more popular, these Medicare Advantage plans over the years, is because in addition to offering healthcare benefits, they offered dental benefits, vision benefits, all under its HMO, in which everybody who enrolled had all of their medical, their healthcare, their medical, dental, vision care. They could buy their glasses, have their tests, their blood tests, their dental visits, all under one roof, so to speak.
Gotcha.
You don't have to go out and buy separate dental insurance or vision insurance. Everything is there.
Sure.
Now, getting back to the federal, though.
Yep.
There's a rule out there, Dan, when you're a federal retiree, and boy, do I emphasize this when I do whether I do FERS webinars, CSRS webinars, talking about benefits for retirement, that if you are a federal retiree and you're enrolled in the federal employee health insurance plan, don't make the following mistakes. Don't ever drop out of the federal employee health insurance program when you are a retiree. Why? Because you cannot get back in.
That's right.
You can get back in if you drop out while you are an employee. You have to get back in during an open season. But when you are a retiree, no such opportunity. Once you're out, you're out.
Right.
Now, there are two exceptions to that. No, you can't drop out. There are two exceptions in which a federal retiree can, note the word, Dan, suspend their FEHB coverage. What does suspend mean? It does not mean dropping out. It means that you're going to leave the program temporarily with the opportunity. You have the options of getting back in during an open season. And what are those two opportunities? One, you are a military retiree. You retired from the military, either on active duty or maybe you were a reservist, you retired as a reservist. You have access to what's called TRICARE. TRICARE is the group health insurance program covering retired members of the uniformed services. If you, let's say, were a federal employee and you had FEHB, you retired, and then you get this opportunity to enroll in TRICARE, especially when you're 65, because when you're 65, TRICARE, there's something called TRICARE for Life, which is free. You don't pay anything. Okay. So if you like to try TRICARE, you could suspend your FEHB program, get into TRICARE, and then later, if you want to, come back to FEHB. That's the first exception. Now comes the second exception. There's always been this exception. If you as a federal retiree would like to enroll in one of these private Medicare Advantage plans, you are allowed to do so. You can suspend your FEHB health insurance that you're in. You have to, you're staying in Medicare A and B, and then during an open season between October 15th and December 7th, you could enroll in a Medicare Advantage plan.
Gotcha.
Try it out for a year. You don't like it, you get out of the Medicare Advantage plan and get back into the FEHB program. Okay. So that's what I was saying. Right now, those two programs, the FEHB benefits open season and the Medicare open enrollment period are coinciding.
Yep.
But I'm sure we're going to get into this here in a few moments. There is one reason a federal retiree, and it has nothing to do with eligibility purposes. It deals with money.
Oh, yeah.
That why a federal retiree is encouraged not to try a private Medicare Advantage plan during this open season. They should stay within the FEHB program.
Gotcha. Well, as a matter of fact, it's an excellent segue, Ed, because I have it right here written down in my notes. And next up, you give us 2 reasons why a Fed might not want to select a private Medicare Advantage plan. So hit us, Ed. What are they?
Okay. First reason, Dan, like I said a few moments ago, when you are a federal retiree enrolled in the FEHB program, the federal government continues to pay 72 to 75% of your premiums, no matter which health insurance plan you're enrolled in under the Federal Employee Health Insurance Program.
Gotcha.
It could be a PPO, it could be an HMO, it could be a high deductible health insurance plan, whatever plan you choose. If you enroll in a private Medicare Advantage plan, you're going to have premiums to pay.
Yes.
The government's going to pay nothing. You got to pay the entire cost of those premiums.
That does not sound as good.
Doesn't sound so good. All right. So that's reason number 1, Dan.
Okay.
Reason number 2, and this is the more important reason. If a federal retiree has his or her favorite doctors, dentists, ophthalmologists, optometrists, they swear by their internists. They swear by their cardiologists. You have favorite doctors.
Absolutely.
There is no guarantee that doctor, that dentist, that ophthalmologist, that cardiologist, whoever, will be in the network of the Medicare Advantage doctors, dentists, ophthalmologists. You are stuck with those whoever's in that Medicare Advantage plan. So if you want to make sure, absolutely certain, that you're going to retain your doctors, dentists, ophthalmologists, cardiologists, you should not enroll in a Medicare Advantage plan because you have no guarantee.
Gotcha.
Those are the 2 main reasons.
Okay. So Ed, to be clear, is this a differentiation between a Medicare Advantage plan outside FEHB and one inside FEHB, or is this a distinction between an FEHB plan and a Medicare Advantage plan, whether it's inside of the FEHB umbrella or not?
Yeah, well, yeah, it's really for both. It's really for both. For both. But I'm going to get into the FEHB plans here because we might as well talk about it now.
Yeah, go ahead.
That starting in 2017, Dan, the FEHB program run by OPM decided, since these Medicare Advantage plans are getting so attractive in the private market, why doesn't the FEHB program offer Medicare Advantage plans?
Sure.
I mean, what is the advantage of that? One advantage is the first reason I said. If a federal
Uncle Sam kicks in.
That's right.
Yeah, I like that.
They're going to be paying that 72 to 75% of the premiums for that FEHB program sponsored Medicare Advantage plans that they did not in the private plan.
Sure.
That's going to be some savings.
Absolutely.
And you can look at these FEHB program plans that are in fact Medicare Advantage plans and check them out to see if those plans include doctors, your favorite doctors. There might be a chance because some of these these Medicare Advantage plans offered by the FEHB program are what they call PPO plans, not HMO. They're PPO. There's a difference here.
Gotcha.
And if a doctor is a PPO doctor, they accept whatever the insurance company will pay them. Then there might be a very good chance that your favorite doctor, who's a PPO doctor or dentist, will be accepted in that, will be in that Medicare Advantage plan. So
gotcha.
You're better off
choosing
an FEHB sponsored Medicare Advantage plans.
Gotcha. No, that makes sense, Ed. And I think this might be a good place just very quickly to touch on a couple of basics here. So our feds work through their career, they reach age 65, and let's say for ease of numbers, they retire at 65. They do have some decisions to make regarding Medicare. The one's pretty easy, just sign up for Part A because there's no cost for it. And then folks may be debating the advantages of signing up for Medicare Part B while they still have their FEHB plan and possibly their FedVIP plans as well. Correct. So that's where somebody is at kind of the base level, reaching age 65, being retired, and being in FEHB. Correct.
That is correct. And I just want to follow up one thing you just said about enrolling in the FedVIP.
Mm-hmm.
If a federal retiree retire and they're enrolled in Medicare A and B and they have their FEHB plan, their health plan, just a regular, it's not a Medicare Advantage, it's a regular fee for service PPO plan. They don't have much in dental coverage.
Gotcha.
They don't have much in vision coverage. And they're going to need some dental and or vision insurance. And the FedVIP is there for them. They can enroll in during an open season.
Yep.
They pay the entire cost of the premium. The government kicks in nothing.
Gotcha.
They might be better off enrolling in one of those Medicare Advantage plans where they got all this coverage under one roof.
Oh, I see.
You know what I mean?
Sure.
People like convenience, having everything there rather than going all over the place for their separate medical, dental, and vision needs.
And sure, if they look at a PPO and their favorite doctors are in that, and then there are dental and vision benefits there, if they get it through FEHB, Uncle Sam's kicking in on those where they wouldn't be through FedVIP, correct?
That's correct. That's
a great point.
That's a very important distinction here. I want to say one more disadvantage of those Medicare Advantage plans.
Sure.
On the private. And this is very dear to my heart, Dan.
Mm-hmm.
I'm sure you've heard of senior abuse.
100%.
And one of the problems that's happened in this private Medicare Advantage plans, there is no lack of insurance companies who are trying to push themselves on people age 65 or over. They're trying to sell them Medicare, Medigap plans. They're trying to sell them Medicare supplement plans.
Right.
They're trying to sell them Medicare Advantage plans. And the Center for Medicare and Medicaid Services, CMS, has come down hard on this salesmanship, trying to sell these plans.
Good.
And one of the areas of abuse has been, when it comes to Medicare Advantage, is that there are individuals selling Medicare Advantage plans from private insurance companies.
Mm-hmm.
And they tell prospective buyers, they promise them the world, everything that this Medicare Advantage plan will give you. Oh, the plan will pay for transportation costs to your doctor, your dentist. They'll give you money back. They'll put money in your account. Mm-hmm. They'll do everything possible to make you happy. When in fact, some of these promises don't have the weight of anything. They're lying, for lack of a better word here.
Not good.
Medicare has gotten down so tough on this. Their ethics rules galore here.
Good.
With the federal employee health insurance plans, if you choose a Medicare Advantage plan within the federal employee health insurance program, they are regulated galore.
Mm-hmm.
You have the full faith of OPM that no abuse is going to happen.
That's important.
With important plans. I gotta just add to you, Dan.
Mm-hmm.
I became Medicare certified.
Yes, you did.
And what I did was I had to pass a very difficult exam given by the Center for Medical Services, in which I had to answer all questions about Medicare, how it works, how it's sold, what you can do, what you can't do, everything. It was 100 questions. You had to get 90 questions right. If you didn't get 90 questions right, you failed. It was very difficult.
Sure.
And I got my certification, which does what, among other things? I can sell Medicare Advantage plans.
Mhm.
And it wasn't 3 days after I passed that exam, I got 10 to 15 calls from these companies. Hey, would you like to sell that? And I said, I'm not interested. I'm not interested. I want to explain to people what Medicare is, what Medicare Advantage plans are, et cetera, et cetera.
Absolutely.
And this is what I'm doing now. This is basically, I'm consulting.
Mhm.
And everything I'm doing right now is strictly not for my sake. It's for, of course, I'm under Medicare too, so it helps
Sure.
us. But I'm trying to help people do the right things when it comes to enrolling in Medicare, every part of Medicare, including picking a Medicare Advantage plan.
Absolutely. And Ed, another place, I can't believe I'm getting get to this before you do. Another place where you're doing that every single month with us at Serving Those Who Serve is there is a webinar that covers Medicare, FEHB, and TRICARE. So
That is correct.
I can't believe I beat you to the plug.
I always have to ask your commission, is it okay to advertise our webinars?
Absolutely. Absolutely. And folks, now you'll even get on occasion to catch both Ed and me on those. So they've let me out of the office and let me join the webinars. So we're having a good time with that. And
the
we do our best.
And the FEHB and Medicare webinar, Dan, it's actually entitled Understanding Your FEHB, Medicare, and TRICARE Benefits.
Yep.
It's held every month, Dan.
Yes, it is.
And if you go to www.stwserve.com, www.stwserve.com,
Yep.
and click where it says webinars.
Yep.
You'll see all the webinars we do and the dates, because we do on average 7 per month, but every month we always do an FEHB Medicare webinar and TRICARE webinar. Sign up. It's free, Dan.
Yes, it is.
You can enroll as many times as you want.
Yes, you can.
You can ask questions.
Yes, you can.
There's no such thing as a dumb question, and we'll be there to answer them.
Absolutely. Absolutely. So, that is one of our core 4, folks. And the core 4 are the ones that we make sure we do every single month. Then we have 4 electives that we pretty much do every other month. And then we have another 3 alternatives that we do once a quarter. So we try and cover all the topics for our feds. And as Ed indicated, we've got live Q&A in there. The one thing I'll tell you, full disclosure, the one question we can't answer is, what should I do? Okay, within the confines of the webinar. Okay, so let's get back to your article, Ed, to wrap this up. Now, you round that with 4 pretty important points to consider, and one of them you've already touched on, and that is, if you're considering a Medicare Advantage policy, make sure your docs are in there.
Mm-hmm.
So we already covered that. Then you remind us that Medicare Part B premiums are indexed based on income. So talk about that a little bit.
Yes. When it comes to Medicare Part B, you have to pay a monthly premium.
Mm-hmm.
And that monthly premium you pay each year is based on your adjusted gross income from the year before that. So, for example, right now, I don't know which, have you received yours yet? I got my note. I got our notice, my wife and I, because we're over
Yes.
65. What
Yes.
we're going to be paying.
I got mine too.
Okay.
Yep.
And that notice was sent out, I think, late November. And it tells us what we are going to pay for our Medicare Part B premium.
Yep.
Starting in January 2023 for all of 2003 each month, because Medicare Part B premiums are deducted for most people from their Social Security check. And if you're not getting a Social Security check, they will be automatically debited from an account that you specify. You set up what's called Easy Pay. But here's the point. That Medicare Part B premium that you pay was determined based on your adjusted gross income from the year 2021.
Mm-hmm.
2021. Now, why 2021? Social Security sends out this notice, and what Social Security is looking at is from your 2021 tax return, what was your adjusted gross income? Okay. Why are they using 2021 and not 2022? Because you haven't filed your 2022 tax return yet.
Makes sense.
You already filed your 2021, and that's where
Yep.
they're getting information.
Gotcha.
And then next year around this time, they're going to send you a notice for what you're going to be paying in 2024 for your Medicare Part B premium. And that'll be based on what? Your 2022 adjusted gross income. Because by that time, you're going to be filing your 2022 tax returns in the spring or maybe early summer 2023. So I'll have the information by the time of notice. What I think everyone has to keep in mind about those Medicare Part B premiums is that the higher your income, the more you're going to pay for Medicare Part B premium.
Sure. So
you want to make sure, and we talk about this during the FEHB monthly webinar. We show the chart. We show the chart of Medicare Part B premiums, and we show those income levels. They're called income tiers. Income tiers. There are things you can do to make sure that you stay within a particular income tier, not be pushed to a higher one, resulting in having to pay more in Medicare Part B premium. We'll make some suggestions. For example, your income consists of maybe a CSRS annuity, a FERS annuity. You have investment income. You have Social Security. You have traditional IRA distributions, but not Roth. Everything coming out of your Roth is not taxable. That won't be including your income. By having a little more Roth to your name, Roth IRA, Roth TSP, that'll cut down the amount of your gross income, which could result in paying less for Medicare Part B.
Gotcha.
And I want to say one more thing.
Sure.
That anybody who got a Medicare Part B notice for 2023, because I have one client who did, and she was very upset. She was very upset. I said, why are you upset? Well, it says that I'm in the third income tier level. There's really 5 income tier levels. I'm right in the middle. And they're basing it on my 2021 adjusted gross income. Well, I was realized something, Ed, that I was working. I was a federal employee all of 2021, and then I retired on December 31st, 2021. My income was way lower. My AGI was probably $40,000 less in 2022 than it was in 2021. Am I stuck with this? I said, I got some great news for you. You can appeal that. It's called an IRMA, Income Reduction Monthly Adjustment Amount. There's a form. I'll give you the form number, Dan.
Go ahead.
This may affect anybody. It's a Social Security form, SSA-44. You get that from www.ssa.gov. Download it. Form SSA-44, in which you can appeal that monthly Part B premium that you were told you had to pay in 2023. You'll have to give them a reason, though.
Gotcha.
So my client said to me, what am I going to put down as my reason? And I showed her the form. They give you several possibilities. One possibility is you got divorced. You have less income. God forbid your spouse died. Here's one no one ever thinks about. You stop working. You're retired. It's called work stoppage. You know for a fact that your income in 2022, you know this for a fact, and you can send in the proof that what your income, your gross income is going to be in 2022. When Social Security sees that, they will say that's a legitimate reason. We are now going to adjust your Part B premium downward.
Gotcha.
So you can appeal it.
Okay. All right. So that's number 2. Number 3 seems like a biggie here. And that is foreign travel and Medicare Advantage coverage. What's up there?
Yeah, that's a biggie, ladies. That's a big one, Dan.
Sure.
I will tell you that if you are a retiree and you are going to do a lot of foreign travel. Now that COVID's behind us, hopefully, people are trying to get back to traveling overseas. I want to be very clear. There is no Medicare coverage overseas. Okay. If you're going to be traveling overseas, you have to have some other insurance. Example, Medicare supplement. For a federal retiree, their Medicare supplement is their FEHB plan. Okay. If you're not in federal service, you may have picked up a Medigap plan. Maybe ARP offers, some, they have insurance and they offer what's called Medigap plans. You have to have something because, this is another area you have to check if you're a federal retiree. You have to ask your plan. You're a retiree, you're under Medicare A and B, and your FEHB plan is your secondary, your Medicare supplement plan. You have to ask your plan. If I am traveling overseas, if I get sick, if I get into an accident, will you cover me overseas? And that's exactly what I did with our plan. My wife and I do travel overseas, and our particular health insurance plan within FEHB, we have standard coverage with that plan. And they said, as long as you retain your standard coverage, we will cover any emergencies, any sudden, medical needs overseas. You most probably will have to pay that, and we will reimburse you for the cost of your care overseas.
Gotcha.
And then I said to him, I was thinking about maybe reducing the amount of our FEHB because we're under Medicare. Medicare is paying the majority of our costs, 60 to 80%. Maybe drop down to a version of our FEHB insurance that's a little cheaper. We have standard. I'd like to go down to basic, and the premiums will be cheaper. And I asked, is that possible? So the FEHB plan said this. When I called their office, they said, if you go down to basic, we are not going to cover you overseas. So any federal retiree who is enrolled in Medicare A and B and has as their Medicare supplement plan, FEHB, which it would be, please check with your plan.
Absolutely.
That you have a coverage overseas, foreign coverage. And, right now we're in an open season.
Oh, yeah.
Again, it's going to end on December 12th.
Gotcha.
If you're a federal retiree, like if you're from, you can change your plan. Change your plan. If you're going to change your plan, you got to do it before Monday, December the 12th. Something to think about. Now, what does this got to do with Medicare Advantage? Medicare Advantage is not going to cover you overseas because, again, it's part of Medicare here. It's part of Medicare.
Sure.
There's a very small chance, almost non-existent, that a Medicare Advantage plans will cover overseas care.
Now that's important. And sort of in that same vein, and this one really jumped off the page to me when I read it, your last caution is that some Medicare Advantage plans may only cover a Fed in a certain region of the country, not even the whole country, correct?
That's correct. You got it, ladies and gentlemen. You have to do your homework here.
Sure.
This is not easy stuff. So before you enroll in any Medicare Advantage plan within the FEHB program, I'm not going to talk about going outside that annual enrollment period. Please stay within the FEHB for the reasons we stated earlier. Stay within the FEHB and choose a Medicare Advantage plan and ask the plan, here's where I live. Does my Medicare Advantage plan cover me in this geographic area? The question is free. The answer is free.
Sure.
Do it. Don't make a wrong switch to any health insurance plan unless you know for certain it meets all of your needs. And if you're talking about a married couple and your spouse, you are the federal retiree and your spouse is a non-federal thing. If you're enrolling in Medicare Advantage plan, number one, both of you have to be enrolled in Medicare A and B, and make sure that the plan covers not only your needs, but also your spouse's needs.
Gotcha. And folks, once again, I will reiterate, it's great to listen to this, but you need to head to scwserve.com and read Ed's actual article in the Fed Zone, because he always includes great links and great examples. And Ed, one of the ones I love that you have in this one is that you have a link to the Consumer Checkbook Guide to Federal Health Plans.
Mm-hmm.
That is such a great resource. So folks, be sure to read the article so you can see that and go check them out. We have no financial relationship, professional relationship with them. I've used them for years as part of, being able to help people navigate what decisions they should make within FEHB. It's a great resource. Can't speak highly enough about it. Ed, you've done it again. Don't know how you do it, but I'm glad you do it with us, and I'm very grateful that you are here, being the resource you are to the federal community and to us at Serving Those Who Serve. You definitely raised the level for us.
My pleasure. It's always a pleasure helping the federal community in any way possible.
Yep. Well, folks, that's a wrap. We are, say it with me, Serving Those Who Serve. Be sure to subscribe to this podcast on our YouTube channel and on Spotify. Please remember to share it with friends and strangers. Check us out on Twitter and LinkedIn. Don't forget our live webinars every single week. Just go to swserve.com and you will see the red webinar button. Click it and it'll take you to our landing page. The guru will come to you. Sign up for one, sign up for all, share it with friends. And be sure to read Ed every week in the Fed Zone. That's fed-zone.com. And be sure to sign up for the weekly serving. If you just visit our website, a pop-up screen is going to be there. You put your email in there, and we will get the best of Ed and all the rest of the Fed Stars out to you every week. So for Ed, the crew at Serving Those Who Serve, and me, Dan Sipe, I will end, as I always do, by saying good luck, Godspeed, and above all, remember, it's your Fed life. Make it a great one, because, don't ever forget this, you deserve it. Stay well, everybody. We are out.
Thank you for listening to the FedLife podcast. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Serving Those Who Serve or Raymond James. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Securities offered through Raymond James Financial Services Incorporated, member FINRA SIPC. Investment advisory services offered through Raymond James Financial Services Advisors Incorporated. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services.
Raymond James is not affiliated and does not endorse the opinions or services of any of the quoted professionals or their respective firms. Any opinions are those of Dan Sipe and not necessarily those of RJFS or Raymond James. This case study is for illustrative purposes only. Individual cases will vary. Raymond James is not affiliated with and does not endorse the opinions or services of the quoted professionals or their respective organizations.
Neither Raymond James Financial Services nor any Raymond James financial advisor renders advice on tax issues. These matters should be discussed with the appropriate professional. Investing involves risk, and you may incur a profit or loss regardless of strategy selected, including diversification and asset allocation.